Thank you, Chairman Alexander, very much. I'd like to offer Bennett Amendment number 1. Last week I visited and I'm going to withdraw the amendment, Mr. Chairman. Last week I visited the pediatric cancer wing at the University Hospital in Cleveland. I met with a doctor who's devoted his life to helping children beat cancer. He told me about the incredible progress researchers and doctors are making in the field, but also how there's so much more work to do to ensure kids with cancer have a fighting chance to grow up and lead full lives. Under current law, drug companies must study an adult drug on children if it treats the exact same disease. However, this law hasn't worked for cancer because kids get different types of cancer than adults. So these precision medicines aren't studied at all for children, but it's still cancer. The FDA saw this disparity and recommended changing the law. This change would make it possible to research the most innovative cancer breakthroughs for children. This bill would be life-saving for our kids. This bill could have been life-saving for kids like Delaney from Grand Junction, Colorado, who battled cancer for over 5 years and passed away a year ago when she was out of treatment options. I wish she could be here with us today to advocate for this bill. Delaney once said she heard that, quote, God gives his hardest battles to the strongest soldiers. Well, we're still fighting for Delaney and other kids that are facing cancer, and we have no intention of stopping. I want to thank Chairman Alexander and Ranking Member Murray for their leadership on 21st century cures, and Ranking Member Murray, who has helped children get access to life-saving treatments through her work on this committee. I also want to thank the Chair and Ranking Member for their leadership on Breakthrough Therapies, a bill that I wrote with Senators Burr and Hatch. Right now, we have some of the world's most innovative breakthroughs in cancer, and this committee just passed the 21st Century Cures Act. Cures needs to be available to everyone, especially children. There are physicians and parents that learn about breakthroughs in cancer, and there's no way for these children to have access to those drugs. I know this isn't easy. It hasn't been. It's been a tough negotiation, but whatever language we agree on, we need to be able to look at those parents and tell them that breakthroughs in cancer are now available to children. That's my request today, Mr. Chairman. I want to thank you and Ranking Member Murray and your staff for the work in helping us advance Race for Children to this point. I understand that we're not in a place today to adopt the amendment, but I'm asking for a commitment from the Chairman and the Ranking Member as we move to the floor to work to incorporate the FDA's recommendations on pediatric cancer into the user fees bill.